Okay, so next we have Robin Latendresse. So she is a nurse on the infectious diseases team. She has been with the health unit for 19 years and on the infectious disease team for 13 years. So, hi, Robin.
Okay, I will get started with the final presentation. And the topic of my presentation is Outbreak Resources. So what I'll do, I'm going to share the outline of this presentation. Before we get right into the outbreak resources, I will just quickly go over outbreak detection. So looking at methods and ways that we can detect an outbreak. We can look at the outbreak definitions and case definitions. These are the provincial definitions that I'll be reviewing. And then we will quickly review when and how to report outbreaks to public health. And then finally wrap up with a look at our local outbreak resources. And I'll take you on a quick tour of the Southwestern Public Health website that we've recently updated. Okay, so getting into outbreak detection, and Rodora did talk about surveillance. So I just wanted to reemphasize the importance of having a well-functioning surveillance system in place at the long-term care homes and retirement homes. Specifically, just wanted to mention that syndromic surveillance focuses on early symptom recognition, and generally we're looking at syndromes. But you could also be doing surveillance for a variety of other infections. And it's critical that staff that are providing care and are involved with residents are monitoring routinely for new infectious symptoms and tracking those symptoms on a daily surveillance form and sharing that form with the infection control lead or director of care at the facility. And then that individual will be looking for clusters of cases. So if we're tracking those daily symptoms on this daily surveillance form, it will be a way of, it helps with establishing your baseline for infections. So we know what's normal at a given period of time, seasonally at your facility for specific infections. And again, it also helps us to get a sense of when there's a cluster of infections occurring. And when there is a cluster of infections, so maybe you've got a couple of residents with similar respiratory symptoms or enteric symptoms, that would trigger the assessment of a possible outbreak occurring. And then from there, we would start an outbreak line list. So my next slide, we're just going to take a quick look at the daily illness line list. And this is different than an outbreak line list. Again, this is just for tracking daily residents with new symptoms. And again, it can be used for a respiratory illness, gastroenteric illness, potentially skin and soft tissue infections, and urinary tract infections. And as well, surveillance also usually encompasses not only the symptom assessment, but looking at your pharmacy report, so antibiotic usage and lab results as well. So this is just a sample copy of a daily surveillance form. And Rodora had mentioned there is a surveillance package available online. We have a link to it on our website. It's a package that was developed by ICAC Canada and Public Health Ontario. So I would just encourage you to look at the surveillance toolkit available online. So next, we're going to get into just looking at, determining you maybe have a cluster of cases, trying to determine, is it an outbreak that's occurring? So on this slide, I've listed the provincial standardized outbreak definitions for both suspect and confirmed outbreaks. Now, we can deviate from this a little. If you have, more cases than what you would normally expect, it might not fit neatly into one of these definitions, and we can still explore a possible outbreak or a confirmed outbreak that both the health unit or the facility can declare. I won't go into a lot of detail here of the outbreak definitions. The respiratory and influenza definitions are the same, haven't changed, have been the same for many years. And generally, it would be a suspect outbreak would include if you have, more than one resident with potential new respiratory symptoms. Again, within a certain time frame on a specific unit, you've got the 2 cases. That should, of course, be a trigger that you might have a respiratory outbreak occurring. And a confirmed respiratory outbreak is 3 or more cases within a couple of days, or possibly 2 or more units with having cases within a couple of days. Or lastly, this one kind of fits in with the flu definition. If you've got 2 cases, with one being lab confirmed, that would be a confirmed respiratory outbreak. And we know with COVID, things have been a little bit more complicated in terms of, the COVID outbreaks. And these definitions I should highlight because they've just recently changed earlier in October. The new suspect outbreak definition is one lab confirmed resident case where the source of acquisition is thought to be within the home. And this is molecular confirmation of infection, so your PCR result. And Elaine had emphasized the importance of getting PCR lab results for symptomatic staff or residents. If you are doing rapids, the PCR test should be done concurrently, but best practice is to do PCR for anyone with symptoms. So that's a slight change from the previous definition, as well as the confirmed COVID outbreak is now 2 or more residents with an epi link. So similar geographic area within the facility, each with a positive, and this could be a molecular or rapid antigen test within a 10-day period. So they've removed visitors, volunteers, and staff from the confirmed COVID outbreak definition. So I just wanted to point that out. And then, of course, the enteric outbreak definitions have remained the same as what they have been historically for the last for a while. Okay, the next slide is just how to determine if someone who has symptoms should be counted as a case. So these are what we refer to the outbreak case definitions. So this is different than the outbreak definition, and these are generally developed based on what we're seeing within the home, particularly for respiratory outbreaks. So, if we've ruled out COVID and we're waiting for, test results, whether or not we have other test results, we generally develop a respiratory case definition based on the clinical presentation of the symptomatic residents on the line list. So we'll look at that line list, the outbreak line list, and we'll see what symptoms they have, and we'll use that to develop the respiratory outbreak case definition. And it often is worded in a way where we would say 2 or more of the following symptoms, and the symptoms would be pulled from your line list. So what the common symptoms that we're seeing among the symptomatic residents would be used as the in stone and might be revised as the outbreak evolves to make sure that we're capturing all cases. Influenza is generally described very similarly to the respiratory outbreak definition, but would include fever and cough, plus 1 or more symptom. Now, in our long-term care homes and retirement homes with seniors, we might not necessarily see fevers, so we need to be mindful of that. But often we will say fever and cough plus 1 or more symptom, just being mindful that seniors may not present with a fever. COVID is a slightly different definition and is based on lab results. So anyone who has a lab confirmed infection with or without symptoms would of course be counted as a case. You might have individuals with symptoms that are clinically compatible with COVID, and they may not have a lab test result, but they're linked to a cluster of cases within the home or have had an exposure, and we would count those as well as cases. On our end for public health, we would technically consider them probable, but they should be, of course, counted on your line list. Enteric, the definition of a case is described here as well, and it's often 2 or more episodes of vomiting or 2 or more episodes of diarrhea or a combination of the 2. So 2 or more episodes of vomiting and or diarrhea within a 24-hour period. And again, one of the important things when looking at these case definitions is the symptoms should be new and unexplained and not related to another underlying chronic condition or potentially with enteric a medication change or diet change or laxatives. So that is the case definitions for outbreaks. And I will be looking a little bit more in the coming slides on the outbreak line list. Okay, so next, before we look at the line list and the resources, I just wanted to quickly review when to report an outbreak. And I would suggest whenever an outbreak is suspected. So you may call to consult public health. If you just have one symptomatic resident, we can discuss lab testing and isolation. But definitely, if you have more than one case, we would recommend you call to report a suspect outbreak. The early detection of outbreaks is critical, and of course, the timely implementation of control measures in preventing further transmission. So the sooner we identify a possible outbreak and get those control measures in place, the better. It can lead to decreased outbreak duration and, of course, decreased risk of spread, so fewer cases, which ultimately will lead to hopefully decreased complications and severe outcomes if we have fewer cases. So how to report on this slide here, I just have our contact information. So you can, of course, call us and you can reach out to the person that you usually deal with at the health unit. If you're unable to reach them, you can call the infectious disease call lines, and I've listed the extensions for both sites. And this is during regular business hours, so Monday to Friday between 8:30 and 4:30. Of course, reach out to us, to the person that you normally talk to, or call extension 1232 in St. Thomas or 3500 in Woodstock. And just really important if you're calling after hours or on weekends and holidays. We won't get those messages if you call the 3500 or 1232 after hours. So it's really important to press 0 and your call will be redirected to a staff member that's working on the weekend and you'll get a call back. So you can call the local number or the 1-800 number and just press 0 if you're calling after hours, weekends, and holidays. And again, you can call if you just have, one individual symptoms that you'd like to have a quick conversation about. And definitely, if you have any clusters, reach out to us and we'll talk about next steps. I wanted to highlight a new outbreak report form that we have online. So if you'd like to use this form, it's brand new. It's not on our website quite yet, but it will be available very shortly. And you can report new outbreaks to us online. You will be prompted to give some of the outbreak kind of details, the basic information about what's happening, and as well to start your line list and upload your line list onto this outbreak online form. This form will be reviewed by a public health member who will call you back to discuss next steps. You can also use the online report form to provide updates for existing outbreaks. So if you have an outbreak that's underway and you'd like to just share a new line list, or if you have other updates, you can go on and click the form for update existing outbreaks. You'll be prompted to put in the outbreak number, and then you can upload your updated line list or just enter any new relevant information. And we will, of course, get that information and reach out to you just to discuss. Okay, so that's reporting an outbreak. And then next, I wanted to highlight some of our outbreak resources. So we have just updated our outbreak resources, and they are available online as well. So these line lists and other resources, such as the control measures, will be provided to you directly when you call to report an outbreak. But if you're interested in just having a template copy or looking at these resources, they are available online. And of course, if you're using the online outbreak report form to report an outbreak, we do highly recommend that you start this line list and upload it online for us. So these templates, of course, are available online. And I will take us on a quick tour of the website. The one thing that I should point out with this updated outbreak line list template is that it can be used for respiratory or enteric outbreaks and for staff or residents. We do, of course, ask if you're completing a line list for staff and residents to do them separately. And we have two versions available on our website, one that you can print and fill out, or one that you can fill out electronically. Okay, and then our control measures checklist have also recently been updated to be inclusive of the new recommendations that just came out for COVID outbreak management. So we've got 3 different control measures checklists available for long-term care homes and retirement homes. One is for the confirmed respiratory outbreaks. We have a separate document for suspected respiratory outbreaks. That's a condensed document just to provide a high-level summary of what we would recommend you do during a suspected outbreak. And then we have confirmed enteric outbreak control measures checklist as well available. And the templates are online. Okay, and then we've also updated our outbreak quick reference tool. So this is a handy tool that you might want to have printed off for staff at the nurses' stations. It just reviews like a high-level summary of the different types of outbreaks. So enteric, respiratory, influenza, and COVID outbreaks are all covered on this one tool. It's 3 pages. The case definitions, outbreak definitions are summarized on here, as well as a high-level summary of the outbreak control measures and outbreak resolution criteria. You'll notice at the top of the document in the 2 different categories under outbreak detection, the enteric, respiratory, influenza, and COVID is highlighted and underlined in blue. And if you click on those links, it will take you to the Ministry of Health outbreak and case definitions. So the appendix 1 for respiratory and enteric outbreaks, and for influenza and COVID, it takes you to the appendix 1. So the provincial documents for influenza and COVID as well. And then further down under the pink section, we've got the enteric, respiratory, influenza, and COVID as well highlighted. And if you click on those links, it takes you to the provincial outbreak guidance documents. So there's 3 documents, one for enteric, one for respiratory and influenza, and then one for COVID. Okay, and then I just have a sample of some of the outbreak posters and signage that are available on the Southwestern Public Health website, available for download and printing. We will also be preparing outbreak packages for you that will be available when you pick up vaccine. And if you are not picking up vaccine, we will get these packages to you. So we'll include some of these common outbreak posters, as well as additional precaution signs and some outbreak test kits enteric. Okay, and now I'm just going to click, and hopefully this will take us to the website. So just a really quick tour, and this, I had it linked to long-term care homes and retirement homes section. But what you'll do if you're going onto the Southwestern Public Health website, under partners and professionals, just click on long-term care homes and retirement homes, and it will take you to this page. So it's just recently been updated and reorganized and a little bit more visual. So we've got our COVID section. We've got a section for infection prevention and control resources. So just to highlight some of the resources, a lot of them are similar to what Redora had pulled up on her slide. And we have links on our website as well directly to the Public Health Ontario modules, and as well as some of the ministry resources as well. And on here, the surveillance toolkit that Redora and I have mentioned. And then there's a section for outbreaks as well that I'll just quickly highlight. We have the outbreak basics on here. So it summarizes the outbreak definitions, case definitions, as well as our outbreak status reports have a section that you can subscribe to. So if you want to stay up to date with what's happening in terms of local outbreaks, please subscribe to this page. And then back here, we have the outbreak control measures and line lists available for download on the website here as well. Okay, and then I'm just going to check to see how I'm doing for time. So just as we're heading over 12 o'clock, I just wanted to summarize just quickly the specimen collection kits. And Elaine had discussed this during her presentation, so I won't go into a lot of detail here. Respiratory outbreak kits, of course, we encourage you to order from HMMS and allow a few business days for the delivery of those kits. And just to, again, just to emphasize the importance of making sure you have a supply on hand to get you through outbreaks. Enteric outbreak kits are available for order through public health directly, so just contact us and we will get enteric outbreak kits to you as needed. We will provide a few to get you started for the outbreak season, so they will be available with your vaccine orders if you're coming into the health unit, or we will get them distributed to you. And then these are just website links to provincial outbreak guidelines and resources, so I won't go through these in detail. It's just, you'll have a copy of this presentation with direct links to the COVID outbreak guidelines, respiratory outbreak guidelines, and enteric outbreak guidelines. And then some Public Health Ontario links as well that Rodora had covered in her presentation. And immunization resources as well, links to Immunize Canada for the flu toolkit that was updated in August 2021, and then just some promotional materials for pneumococcal and other adult immunizations. And that's it.